in.
So this patient's presenting with a lesion that's on the top almost of her shoulder, sort of upper back, that's been there for over 10 years now. So it's becoming visually unappealing for her because there's just a little bit of a bump that's through here. This is an area, like deep to this is the brachial plexus, a number of the structures. We should be running pretty superficial, but you should still be aware of them. This does feel like it has more mass than you'd think, so I think it's bigger underneath than it looks like from the upper part. So we've added some freezing underneath this, and there's also some over top, which is the swelling that's here. So we're just going to see if we can do a linear incision and dissect it down. This will be another one. Maintaining the intact caps will be a bit of a challenge here because it's not swollen so much, but we'll see how we do from that perspective. So this doesn't hurt at all? No pain?
No.
So this is again number 15 blade that we use here. And even though, again, the tissues here tend to be a little bit deeper, I would progress relatively slowly, and we'll see how that opens up for us. That's not hurting at all?
No.
Now you can see from that how it doesn't want to open up at all, so this is consistent with the fact that the tissues here are a bit deeper. And again, I wouldn't be in a big rush here. Just take your time, even if it's quite a bit deeper with things, as long as we progress slowly. And as we get to the right level, so as we get and start to break down the dermis layer, then it'll start to open up. You can see there how that doesn't give at all. That's because we're still within the dermis and epidermis. Still not opening up. She'd said before we started filming that this had ruptured once, and I have a feeling it's right here because you could probably, I don't know if you can appreciate that, but there's like some scar tissue that's here that's not anywhere else. Yeah, you can see that. That's some keratin that's there. So we're right on top of the cyst right now, and you can see that this is where there's probably a punctum at one point in time. See, that's where the keratin's coming, so I put pressure on that. So what I'm going to do with that is, as opposed to opening it right up, so I just want to dissect this back a little bit. Just get under the tissues a little bit. And you're okay?
Mm-hmm.
So I'm just dissecting down on this to get more tissue around the actual cyst so that this is easier to... I'm just going to do the same thing from the other side. side's a bit closer to the surface. I can also use scissors for this. I think it's gonna be too tight for that, but that's not hurting at all.
No.
So all I'm trying to do here is I'm dissecting out essentially beside it. You can appreciate here, this is certainly unfolds more anteriorly. This is within the actual cyst itself. You can see this is all membraning through here. I just want to make that this is more adipose tissue just on top of it. So you can see here, so this is where it's open through here. This is the membrane there, and the rest is contained within here. You see, if I express that, that's all the keratin material that comes out of it, just like that. So what I want to just make sure of, there should be a lip that's here, which is this tissue here that I just want to make sure we take out. So this is the part that what I just showed you is sort of more adherent here. And that's probably where there was a punctum earlier, which was joined there. And I want to make sure that that's clean before we suture it closed. So when I reverse this, that there's no cystic material through here. And the same thing on the underside, and the same thing on this side. This is just adipose tissue all the way underneath it. And that's it, so we'll just suture that closed. one through and pick it up. So try and make an effort to keep this dry for the next little bit.
Mm-hmm.
So you can pick up some watertight bandage if you need it.
Okay.
There is a cream that I'll give you that just helps reduce scar potential.
Okay.
And this is again a case where, because it's we've taken out material and I've made a linear incision, I'm not putting in dermal sutures. And certainly you can have arguments about just always putting them in for strength. The problem being some patients will actually react to them. So if I don't need them, I won't use them. So the risk obviously being is if we don't put in the dermal sutures, can this dehisce, or we go open back up? And here I've just never had that happen in my career here. If I thought it was a risk, then I'd certainly put in dermal sutures. You're feeling okay?
Yeah.
You're almost done.
Okay.
Alright, so that should seal nicely. And we'll see you back in about 7 to 10 days.